All right, welcome everyone to the August meeting of the Community Engagement and Communications Committee. We've got a packed agenda today and some really exciting materials to go through together, so I'm really looking forward to it. And welcome to community members who are joining us. We really appreciate you being here with us or who are watching in the future. Let's see. My name is Michelle Glass. I am the co-chair with Amy Fellows, and we'll run through a tech check, a roll call, and review our agenda, and then we will dig right in. So I will pass it over to staff.
Yes, so just a little overview of the Zoom tech settings. You can adjust your view by at the top of your screen. There should be a small icon in the right. It says view, and that'll change how your screen is laid out. At the bottom of your Zoom window, there are a number of different icons that control different settings, including your ability to turn your audio and video on and off. Please stay muted when you're not speaking, and if you're able to have your video on as a for the committee members, that is helpful. And for members of the public, we do not have that ability turned on. And we do have Spanish language interpretation available today. So at the bottom, you should have a icon that says interpretation, and you can select either English or Spanish as the language channel that you're that's best for you. And with that, I will pass it on for an agenda review.
Great. So as promised, today we will start, like we always do, with our committee and board updates. So really trying to make sure that you all are aware of what's happening at the board level with the other committees that we work alongside. We'll do some materials review. So Patty Wentz, who you all have had a chance to meet and chat with, has been hard at work creating draft materials for us, and we have a lot of those to review today. And we're actually at a point where we're going to ask for, of course, your feedback. And then once we're done with discussion, we're going to ask for a formal vote from you all as a committee to either recommend or not recommend that those committees go to the board for formal adoption. So that's exciting. We're very close to having materials ready to share with Oregonians, people across the state who we want to know about our work. So that's exciting. So looking forward to that. We're going to review our Community Engagement and Communications Committee work plan, which we have updated because a lot has changed since we adopted an initial draft work plan August of last year. And so really looking forward to y'all's input on that. We'll give a status update on the style guide, which is still in process. And thank you so much to all of the committee members who are sending so much thoughtful input and feedback, and also for, just, it's a lot to try and figure out how to summarize in a document. And it's a lot of really rich context. So I'm so grateful. So we'll give an update on that. And then we'll have a chance for you all to share your committee member updates. We will check in on a draft of an updated mission statement for the board. So Patty has taken some drafts from the board, worked them, and is sending it to you all for your input before they go back to the board. And then we've just got a couple of things that are kind of standing agendas that we won't spend a lot of time on, like the communications plan, which is pretty much finalized. And we'll end with meeting reflection and future topics and any public comment that folks want to share with us. So any questions about the agenda? We'll take a break in here somewhere too. All right. I'll pass it over to staff for a roll call.
Yes, perfect. Okay. Michelle Glass.
Present.
Thank you. Amy Fellows.
Here.
Thank you. Grace Hawkog. I didn't see Grace in the list today. Mickey Jerding.
Here.
Thank you. Juan Pablo Villalobos Garcia. did not see in the list. Colin Stackhouse,
Here.
thank you. Max Brown,
Here.
thank you. Jensina Hawkins,
Here.
thank you. Jay Brown, I did not see Jay today. John Buzzard,
Here.
Did you
I
hear
see.
him, Isabel? There was a here. It was quiet,
Okay,
but it was there.
perfect. I didn't hear it, but okay, perfect. Craig Newton. Didn't see. And Juana Jensina Hernandez Solis.
Here.
Thank you. And Jocelyn Ogden.
Here.
Perfect. That's everyone. Thank you.
Thanks, Isabel. Appreciate it. And thanks everyone for being here. All right, I believe I'm going to hand it over to Executive Director of the Board, Mimi McDonald, for the August update.
Hey, thank you so much and welcome everyone. We're just so happy to have you all here. As Michelle was mentioning, we are really trying hard to make sure that all of the committees know what's happening in the other committees and at the board level. So we just last week, there was a board meeting and the main focus of the board meeting was learning about the work that's been going on in the Finance and Revenue Committee for a revenue plan. In other words, what are some of the potential sources of ways that essentially, money essentially will be shifted around in Oregon to be able to support a universal health plan. So that is still ongoing. There was no board level decision made about the revenue plan at all at that meeting, but just lots of content coming up. Next, there was also discussion about the sort of the way that the universal health plan, the structure itself will be set up. And there's a discussion around how regional entities will play a role in the integrated system of the universal health plan. There was a proposal that came forth from plan design and expenditure about primary care payments, how that will be modeled, and actually that proposal was passed. So that is mostly about the board. Michelle or Amy, is there anything you'd like to add about the board?
I don't think so. I think that summarizes it.
Okay, great.
And just a reminder that the recordings are available to watch. Sorry, Michelle.
Yes, that's a great reminder. I also just wanted to mention there was public comment actually that I think is relevant to our work at the board. And that public comment was really pointing to the need to make sure that we're really thoughtful and that we do no harm, which is something we talk about a lot here, in how we present all of our work. So not just this committee, but the board and the other work groups and the consultants. And so I think that to me, that person was providing public comment on some of the slides, some of the graphs that one of the consultants had brought to the board, and saying, if you're not following this really closely and really trying to understand all of the context, this graph could be really scary for Oregonians. And so please, be strategic in your communications, be thoughtful in your communications, because all of this is public record and could really hurt this effort. So I bring that up because that is the work of this committee. And we are getting ready to finalize materials today that I think will support that goal for the board and the effort as a whole. And so it was really, I think, really helpful to hear that feedback from community members who are following the process as well, just really reinforcing how important that piece of the work is. So wanted to share that back with all of you. Thanks, Mimi.
Yeah, thank you. That's such a great point. So let's see. Plan design and expenditure, as I mentioned, the primary care payment preliminary proposal was passed. So many P's. So that work will be continuing to go forward. Next on the plan design and expenditure agenda, it continues to be provider payments, looking at how hospitals will be compensated in a newer system, looking at specialty care, other inpatient and outpatient settings, of course. And then I realized I did not put this on there. My apologies. I should have also said taking another look at the behavioral health payment system. The committee has already done a significant amount of work on it about what they feel should be included for as services, but really we're going to look more at payment. Importantly, we have a new consultant group, which is called Milliman, which will mostly not be working with this particular committee, but will be working with all of the other committees. By this committee, I mean with CECC committee. So they will be doing some consulting and advising for plan design and expenditure. Next, as I mentioned, finance and revenue continue to be working diligently about coming forward with a proposal of what they recommend to the board. Obviously, the board has the final approval or to be made about what actually the revenue plan should be. The other things that are happening is our Echo Northwest consultant group will be presenting on the impact that that revenue plan would have if it were chosen on individuals, families, and then businesses. And again, I said Milliman will be coming on board. Lastly, but not least, operations. So kind of as I mentioned at the top when we were talking about the board and that how regional structures work within the bigger universal health plan integrated system, operations is definitely going to be working on administrative structure, looking at startup costs, and continuing to do another review around Affordable Care Act, apologies for that, ACA waivers, and looking at how that work will happen between the federal government and the Universal Health Plan. So thank you all very much. And if any questions, if anyone has any.
Thanks so much, Mimi. Does anyone have questions about the board or the other work groups or anything that Mimi just shared? I'm seeing some head shakes. All right, thanks, Mimi. And thanks to those of you that also monitor the board meetings. I know that's like an additional time investment, but really great to have you there when you're able to make it. So, all right, that brings us to material review. So we have 2 one-pagers for the committee's consideration today. In talking with our communications consultant, and again, kind of to step back, now that we have the strategic messaging guide finalized, we are able to leverage that into all the other public facing materials we need. So the one pagers, the FAQ is in the works and coming soon. Some updated website copy will be coming soon. So this is all kind of following on that foundation that you all helped to create with the messaging guide. So thank you. So we did ask Patty drafted a one pager. We realized that there were really at least 2 distinct types of audiences we need to communicate with. One is folks who are not super policy oriented. They are like living their lives and doing the things they need to do. And they just want to understand kind of basically what's happening and how it will impact them and why it matters. So there's a very plain language, simple one pager that is for the general public. And then we knew that there were also some folks who maybe are more policy oriented and or they're providers or administrators, or they are connected to the healthcare system in some way. And they want to understand in a little bit more detail and might be frustrated by the very high level overview. And so there's a more detailed one pager as well for folks who maybe are more interested in the policy details. And I see your hand, Mickey, go ahead.
I'm so sorry. I meant to send a heart.
Love it. Okay, great. No worries. So can we pull up the simple one pager to start? And thanks so much. It might take a second, y'all. I'm also happy to screen share if that's easier. So just let me know.
If you want to drive, by all means, feel free, but I'm happy to pull that up if you prefer.
Let me just see if actually, since I'm on a smaller screen, if you're able to, that would be really helpful. But I can be back up if there's any technical difficulties.
Sure. Shouldn't be a problem. I got it.
Thank you. So one thing I'll say is our one pager is 3 pages. Because it's a lot to summarize in one page, so I'll just be transparent there to start with. So this is and these materials should be in all of your inboxes. They were sent out ahead of time, but just to make sure we're all on the same page. So this is the simple one pager, and it's all in plain language. So what's next for universal healthcare in Oregon? It really leads with some of our values-based messaging, starting with like why it matters, what the problem is, right? That we all feel and understand. And then it frames our work as a response to that, right? So Oregon is taking action in response to the fact that Oregonians believe that everyone should have access to care when they need it, and also that we don't currently have that access because it's unaffordable and overly complicated, right? So that's kind of the start of it. So it talks about the role of the board, that this is a multi-year public process, and that it is in response to a decision voters made, a majority of voters in Oregon that passed affordable healthcare as a constitutional right in the state constitution in 2022. So again, trying to connect it to things that like we are following the lead of people who live in Oregon, we are following the lead of Oregon voters, we're addressing this problem that we all see and feel. And then where it talks about what the board is doing. So it's very clear that we're designing options, that we are not making decisions. We're designing options for a publicly funded health plan that would cover everyone who lives in Oregon. That's, thank you, Style Guide peeps. That is from our Style Guide right there. Planning how it would be run, how to pay for it, how it would work statewide, getting input from people living in Oregon, and delivering final recommendations to the legislature, right? So it makes it clear who the decision maker is. That's the legislature that's going to decide what to do with this plan. So let me pause and see if folks have any questions or input on page 1 of our one pager. Yes, Colin.
This is great. I have one like simple question and then another question. Who was this made? Was this like Isabel Lee based on effort from Patty and then Michelle and Amy, or who's the actual humans who wrote this? Because I'm so happy to see it. I'm just
Patty.
curious. It's all Patty.
Patty
Cool.
drafts materials.
Right.
Amy and I review. We bring it to all of you. You review. You approve or don't approve. You give input. That input gets incorporated by Patty, and then that whatever the final product is will go to the board for formal adoption.
Cool. Thanks for reiterating that. I appreciate
Yeah.
it. It's so good, or I think it's good. But I do have a comment on like the choice on that bullet, the first bullet point underneath what the board is doing about designing options, because that is technically true, but I worry that if we use the word option, then it's sort of like maybe we'll roll into the idea of the public option, which is sort of not what we're doing. Right? We're trying to make a public reality, not something that people opt in or out. And also it's a very designing options is accurate and correct and clear, but I worry that using the word option might confuse people later on or something. So wanted to bring that
Got it. Okay, thanks for that flag. We'll see if you can come up with another word that's plain language that would not evoke public option vibes.
And just people following along, I'm sorry if I missed if this is already said, but under the committees for the Communications Community Engagement Committee and today's date, all of these documents are there for reference, also in English and Spanish. So all the ones that we're covering today, just if people like to, have it in multiple sources.
Yeah, thank you, Amy. Any other questions or input? And then just to say, this is clearly not designed. This is content, right? So we're talking about content. This would be designed for public presentation once we have a final version. So just to say that. All right, let's go to page 2 of our one pager. So why it matters. So again, making it clear that we all understand this context, right? Understand the impact of our current system and how it fails people and what that means for families and individuals in Oregon. So some things to illustrate that. So 1 in 5 rural Oregonians delay or avoid care because of cost. Ouch. Small businesses are being crushed by rising premiums, and providers are burnt out, and rural health systems are under threat, right? So that's 3 key messages that just serve as little snippets to illustrate some of why it matters for different types of people who might be reading this, right? Or who might have different ways of connecting with this. A better system is possible. So again, one of the things in our messaging guide is we never just stay with the doom and gloom. We always add some hope, right? So we know another system is possible. And so now we talk about what comes next. So this is the timeline broken down in plain language. So talking about this year. So like you are here, right? 2025 to 2026, community engagement, financing, modeling, financial modeling, legal analysis, and plan development that all take into account the shifting landscape and healthcare costs from federal actions. By December of 2025, the board will deliver a report to the legislature. By September of next year, 2026, we'll deliver our final draft plan options. We'll look at that word again to the legislature, and 2027 or beyond, the lawmakers in Oregon will decide what to do with that plan. And then there's how to participate. So under Stay Connected, and I think we can probably get this to 2 pages, so it'll be like front and back. It's a little spilled over now, but I think that formatting can be figured out when we go to design. So this is how people can participate. There's a brief plain language description of each of the committees. The fact that you can watch all of these things on Zoom, the website for the board, which again, we will have some updated website copy that Patty will design based on our messaging guide that's much more plain language. And it ends with, inviting people into the process. Let's build a healthcare system that works for everyone, universal, affordable, fair. Feedback on page 2-ish. Colin.
Yeah, on that last paragraph that it says the universal health care, which maybe should be planned. Governance board has 3 committees that meet in public meetings. Sort of indicates that this 4th meeting, the community engagement, is not public, but it is.
Make sure it's clear that it's public. Yeah. Okay, great. And change that typo about Universal Healthcare Governance Board. Thank you for that. Other questions or pieces of feedback? All right, are folks ready for the detailed one? I'll take your silence as an enthusiastic yes. No, I'm kidding. So give us a second to transition. Again, this is for audiences that may want a little bit more detail than what is on this one pager. And of course, also to say that once these are finalized, they can be translated into multiple languages, which is really exciting. Let's see.
Yes, so I think I've got the detailed one up now. Yeah.
Perfect. Thank you so much. So this one, as you can see, even from the beginning, from the title, it is assuming more background knowledge that the person reading it might have. So this assumes that the person knows that there have been other efforts, right? This is maybe folks who are aware of the task force work, or were aware of the ballot measure work that happened in Oregon. So what's next for universal healthcare in Oregon? Talks about the system being under severe strain, right? So again, starting with the shared analysis of like, we all understand this is a problem. We all feel this. So spending growth, you can see that the language is it's still as plain as possible, but it's a little more technical. So spending growth per person health spending in Oregon, rising 40% since 2015, financial insecurity, right? So in 2023, according to this report, 1 in 8 households shared that medical bills had wiped out most of their savings. Barriers to care, provider stress, and employer strain. So again, a few little more detailed snapshots that demonstrate that we understand the different impacts this is having for different types of folks who might be reading this, right? And then same basic format. So Oregon is taking action. So again, here's the problem we all see and experience in different ways. So Oregon is taking action in response to that problem. we're leading the nation, again, in health reform, so like we've done for many years. So we created the Oregon Health Plan in the 90s. We've done lots of things to expand coverage, all rooted in this value and belief that healthcare is a human right. And it talks a little bit about the history, right? So the 2019 bill that created the task force, and then the 2022 vote, and then finally in 2023, the bill that created the Universal Health Plan Governance Board. So giving people a little bit more detail if they want to go look up, some of these bills, or if they want to figure out where this fits in relation to those other things they might have heard about. The board's mandate from the legislature is to design publicly funded statewide health plan options that guarantee coverage for all Oregon residents. Recommend, address, right? So this is still pretty plain language, but just a little bit more. So recommend how the plan should be governed, financed, implemented, and evaluated. Again, making it clear that we are not the decision makers, but that we are doing the analysis, drafting, public engagement, and then making those recommendations to the legislature. That we also have a duty to address federal and state legal requirements. So letting people know that those are things that we are navigating, including Medicaid waivers, ERISA, which some folks who are reading this more detailed version might be familiar with, although I think we can probably include that acronym spelled out at the bottom. I'm just noticing that. And alignment with existing state health reforms. So those are concerns that people who might have more information about healthcare policy in Oregon might have. So we're addressing those concerns and letting them know that we are also aware of those things. And then identify strategies for cost control, quality improvement, and equitable access that reflect Oregon's longstanding commitment to fairness, inclusion, and sustainability. So talking again about the context here at the bottom, it's a little hard to read, but acknowledging that we're doing this work in the context of dramatically changed healthcare landscape. Even since 2023, when the bill that created this board was passed, things have changed a lot. And so talks a little bit about those impacts and that we are aware of that context. So questions, clarifications, feedback, Max?
Yeah, just one suggestion toward the bottom of the page. If we could also mention the bill that created the board in 2023 by bill number, that would be great. And that way people, especially for this audience, can look up that bill and a lot of the information to kind of get the context of the work that the board is doing today after passage. Thanks.
Great, thank you. Good suggestion. Other thoughts? I think I saw two hands and then I just saw one hand.
Yeah.
Did I miss somebody?
Maybe Mickey tried to do a heart again.
Oh,
Yeah, Mickey, you go.
Thank you. I don't know if I missed this, but I was wondering, as you're translating, if we could also include translation for deaf and blind, please.
that's a great question. I will have to see if that is, go ahead, Amy.
I was trying to heart that.
Raise
It's
hand is
official.
the new heart.
Hands are hearts in the CECC. Great. So we can ask if our I know we have a contractor that does the translation interpretation work for us, or maybe two separate contractors actually that do that work. So unless staff has an answer right now, we can definitely check on that.
I don't think we have an answer right now, except that we definitely will check on it.
Awesome. Thanks. Certainly we have talked about in the design, making sure that these are screen reader friendly. So that is one piece that that we do have a plan for and is within capacity and already planned for. But yeah, I think we can explore what else might be possible. Thanks so much for raising that, Mickey. Colin.
Yeah, I'm curious if the one footnote, like the number one footnote about spending growth, does that also connect to the next two, or the next, two bullet points in that first section? Because if it's another, document to cite, we could, at the risk of like having this have a million footnotes, the 1 in 8 households, and then the 15% of Oregonians delay or skip care. So if that's the same footnote, that's cool. I guess I don't know how to like interpret that or know that. And then if we want to keep adding more footnotes, like we could connect Senate Bill 770 and all the rest, but I don't know if that's necessary, but it's a
Great.
choice. Yeah.
Yeah. Great points. Can we scroll a little bit? I wonder if the footnotes fell onto the next page. No. Okay. Yeah, that's a really good question. We can definitely check on that. Thank you. Okay. So what's next? Page 2. So page 2, again, formatting will get cleaned up. The end of the sentence that was at the bottom of page 1 is here. So then we go into the board's work includes. So trying to be clear about what the board is and is not doing. So plan design and all the things that go into that, right? All the components, so eligibility, covered benefits, medical, dental, vision, behavioral health, long-term care, provider payment models, and all the things that go into provider payment models. So we're definitely calling in the wonks now. Financing models, so what goes into that? Governance structure, all the things we're considering and exploring there. Implementation strategy, how do we get from our current system to this system? And engagement. So the outreach that we're going to be doing with Diana Bianco later this year or early next year. And then we talk about why there's an urgency to act right now. So instead of just saying, yes, we're aware of this federal context and we're keeping it in mind, we're actually leaning into it and saying, this is even more reason that we need this plan, right? So we talk about the federal policy changes, how they impact Medicaid, how that could lead to a lot of Oregonians losing coverage, and what that means, right? So coverage gaps widening, cuts in coverage driving up overall costs in the system, health system strain, and healthcare costs continuing the trend that already exists, where those costs are rising faster than incomes for Oregonians. So then we talk about, again, so like, here's the problem we all understand and feel and see, and we see it worsening, and then here's how we're responding to it. So this plan is a response, is a solution that addresses those things. So a publicly funded plan that covers everyone could, right back, so this bullet point, protect people from losing coverage. That maps right up to coverage gaps widening, right? Reduce administrative waste. Freeing billions for direct patient care. So that directly addresses some of these bullet points up above. Lowers overall system costs and ensure equitable access to timely care in every community. And then we go into at a glance, so a summary of Oregon's healthcare challenges, some numbers here, some data points. And then again, the timeline. So same timeline that we saw in the other one pager with maybe a little bit more detail, like we didn't mention ERISA compliance on the simple one pager. And then how to stay connected. And again, less information, less detail here on how to stay connected because we're spending more time kind of getting into some of the other weeds. And we know that this is a group of folks that will probably find it easier to navigate a government website. So we include the link and just let them know what the committees are. And again, ending with a public values-based message. I can't think of the word that we use in our messaging. I'm sorry, but everyone should be able to get the care when they need it, no matter where they live, what job they have, or how much they earn. And I see your hand, John. Go for it.
This is just a real quick thing, but under stay connected, we've got the same language that I think Colin was sharing about the shorter one pager. We have 3 committees that meet in public meetings, that little piece, but then also that sentence mentions 3 committees, but then it lists all 4, including community engagement. So it's actually 4 committees in this case, right? If we go with what's listed here.
Yes.
Yeah.
Thank you. Jocelyn.
I think it could be important to talk about like some of the data of how many healthcare centers have shut down, especially rural healthcare centers. Or just like in that there was one section where it says like it was talking more about like the number of patients that they're able to serve, where I mean a lot of these like especially coordinated care organizations could shut down. So I don't know if we just want to kind of specify that.
So you're suggesting adding some detail on, because I'm not sure that we know yet how many could shut down. It really depends on how many people lose coverage and what Oregon can do to try and.
Yeah, I was thinking over like the past 10 years, but if we don't want to give that data, we could also just say they're at risk of shutting down.
Yeah. Okay, great. Thank you. Go ahead, Colin. Sorry, I'm
Yeah.
taking notes. If it looks like I'm not listening, it's because I'm taking some notes here. Go for it.
Yeah. Two kind of tedious comments. The bottom of this previous page, the second page, I think that last bullet point should have the ensure be bolded because it's the rest of them are bolded, so it would make sense to have that fourth bullet point look the same. And then the timeline on the last page, I think it says in error December 2026, and it should say September 2026.
Yes. September. Yes. Thank you. I love tedious. When we're editing, we need that level of attention. So thank you, thank you, thank you. Anybody else? Other comments? Do folks feel comfortable? So I have 2 pages of notes here, which is awesome. Thank you so much. That'll be really easy for Patty to take your notes and feedback, make those changes. Do folks feel comfortable basically voting on these 1-pagers as with proposed changes? Or do you want the changes to be made and brought back to you before you vote? And what that means is basically if you vote today, and we can do it either way. I want you all to feel comfortable. If we vote today, those changes can be made and then it can go on the agenda for the September board meeting. If it comes back to this committee, it'll come back to this committee in September and then it would go to the board in October. Yes, John.
This is not in the spirit of wanting to throw a wrench in the works or anything, but I was kind of like, as I looked at this before the meeting and including as we're going through it, there's a few other like thoughts that haven't, I just admit, haven't fully formed like enough to share like about some of the language and so forth. So the other thing I was wondering is like any window of time where we could like send an email and just share a few other like wording type of comments, but I can't articulate them on the spot today, but maybe like with a little reflection right after the meeting, I might send an email to share some. So my personal vote would be to, if we could have a little window for any additional feedback to come to you guys over email or something, and then before you completely dial it in, I guess.
Yeah, that's such a great point, John. I really appreciate that. And there are many ways to process information and share feedback, and not all of them involve verbally sharing on the spot in a public meeting. So yeah, I would say if committee members have additional thoughts or want to noodle on what was shared today, that next Wednesday is a week enough time to send any additional thoughts? Amy, do you have thoughts?
I think that sounds good. I was thinking next Wednesday or Friday, so that's perfect.
Perfect. I'm glad our mind meld is working today. Okay. So next Wednesday, I mean, it is a holiday weekend, which is maybe gives you more time or gives you less time. I don't know. Depends on what's happening. But that would put us at Wednesday, September 3rd would be the deadline. End of day, Wednesday, September 3rd for any final feedback. Thank you. All right. So where does that leave us? I mean, I guess if we don't even know what all the feedback will be, I don't know that we can necessarily vote on it even with the changes. So we will bring it back to yeah. Staff, do you have a recommendation for process in this case?
Well, I would say that that does make sense to then bring it back again to this committee. I think that will be fine. The only other option would be, since this, the recommendations from this committee don't need to have a formal vote. So the other option would be, and this kind of depends on how quickly, Michelle and Amy, you feel that you could get it revised with Patty. If people don't mind doing things via email, you could, send out, okay, here's the one with the revisions, and people could send it back, and then we could get it on the agenda for the board. So either is fine, but that might, enable it to get to the board a little bit sooner.
Yeah. Great. That makes sense. So yeah, I mean, we are a recommending body to the board, but also the board really depends on active committees and really relies on your input. So I would love again to ask y'all, are you comfortable once we have the final edits and we've incorporated them, if we email them out and say, here's the final version, and give you like 48 to 72 hours to respond if you like object to it moving forward or want it to come back for another discussion. And then if we don't hear objections, we move it forward to the board. Does that not work for anyone? Does anyone have concerns about that? And again, really want you all to feel comfortable with this process. So please speak up if you're not comfortable with it, and we'll bring it back at the September meeting. Colin.
Yeah, I feel personally comfortable with that process of 1 more week to give feedback. Then sometime soon after that, you'll share a next edit that then we have 48 hours to double check and approve. I'm raising my hand because I'm interested in seeing a version that kind of has a lot of footnotes. A lot of these, if this is like the more robust one pager, like having all of the information anybody who's curious could want to have on this page, I think is important. So that's my last comment on that.
Great. So, and again, the footnotes are for those data points and then also potentially for the bills.
Yeah, just like anything that somebody would want, any data that someone would want to refer to.
Okay. Thank you. And then I saw in the chat also a couple of folks weighing in. So this works for me. Thank you, Yesenia, and also John. Okay. So this is our process. Thank you all so much. We are creating the process as we do the work. So got your awesome edits. There's a week window to submit additional edits to the normal staff email. So by next close of business or end of the day, next Wednesday, September 3rd, and then we'll take those edits and we will give them to Patty to incorporate into a final version, which we will email back out to the full committee. And we're going to, for simplicity's sake, if you approve, you don't need to do anything. You certainly can. You can chime in and say like, looks great. But if you do not approve, you will have 48 hours to email and say, hold up, something's missing, or I just realized we need to change this other thing. Please bring it back to the September meeting. If we do not hear an objection in that 48-hour window, it will go to the board at the September board meeting. If we do hear objection, it'll come back to this committee in September. Great. Perfect. Thanks, y'all. All right. So, and again, if anyone needs to access these to give additional feedback, they are on the website, they are in your email. If you have trouble finding them, let us know. And I think that brings us to the CECC work plan update.
Yes, it does. I'm going to share my screen, Isabel. And apologies to everyone because there were just some minor editing changes that came at the end. So this is just an update. As probably you know, the work plans were created last year and approved by the board. And as there have been some changes, certainly not major, but definitely some changes that have happened. So we wanted to provide an updated work plan, have the opportunity for everyone in this committee to take a look at it, see if they kind of agree with it. And then when as long as it, again, same thing, works out okay, then we will bring it in front of the board for their final approval. So the first thing that you will probably notice here about this work plan update, community engagement, you're all on the hook for a little bit longer. So I hope that you can stick with us just because of some of the delays. Now, I'm being generous with this time, so it may be shorter than March of 2026, but we hope that we'll be able to get people to do that. And again, this is just basically talking about the work that you all are doing. So these are the objectives. Listen, engage. We, called out the specific groups that you'll all be working with and the regional organizations to identify strategies. Again, now this work plan is clearly not intended to be, although available to the public, it's not necessarily in plain language. So I just wanted to be clear about that. Trying to make it clear, but not necessarily at at the level, the same level as kind of the guides that you just were reviewing. So that's community engagement. Now here are the tasks. So the same thing. So you've already done this. You have a CECC committee. You've already reviewed the Joint Task Force final report. You are in the process of identifying strategies to engage with communities. Oh my goodness. And there's another typo. Yeah, I had this bullet point twice, so apologies for that. Those are the tasks. And then the deliverables are the work that you are creating. You're doing that right this minute. Community engagement outreach plans, engaging with key partners. Now, again, this is the community engagement, conducting a minimum of 10 presentations. This is going to be the work that Diana Bianco is going to be doing, of course, with input from all of you all. And that will be going forward kind of over the next several months. In terms of the communications, here's what you just did: develop the plain language materials multiple language. This one goes even a little bit out further, partly because as the board will continue to make refinements and things, we will still, for those who are available, would love to have the input of people on this committee to continue to make it accessible to everyone living in Oregon. And then the deliverables, here we have the tasks. So again, kind of the work that is done and then what is created. So you have your 1-pagers or 3-pagers, PowerPoints, talking points, and then eventually a dissemination plan. And this is going to happen more towards the end. So if you think in 2026, this dissemination plan of the final report to create transparency and raise awareness. So I will stop talking, but definitely would love to hear any feedback. Again, this is kind of just talking about what you're all doing.
Great. Thank you so much, Mimi. And just so you all know, this is our section, our committee's section of the board work plan. So this is how the board kind of checks and, makes sure that we're doing what we've committed to. And so it's part of this larger plan. So definitely would love any of y'all's feedback, because this is the plan that we own and we together, move this work forward. So any thoughts that y'all have? Does this reflect what you understand as in terms of what we're doing? Colin.
Hello. Yes, this reflects what I understand. I have a couple of questions, which I guess confirming that between June and September 2026, there's like no option of, so it seems like this communications and like dissemination plan, we will stop our plan of it in June 2026, but then September 2026 is when the final plan happens. So I guess I'm confirming there's likely going to be no changes to the proposed options between June and September of 2026. And is the dissemination plan, maybe we have to figure out what the plan is, but are we going to try to do all the dissemination before June, or like continue to disseminate between between September and December, or what?
Excellent questions. I think that it is likely, based on how this iterative work has gone so far between the board and all the consultants and all of the work groups, I do not expect that we will have the dissemination work completed by June of 2026. I think we will have a plan by then. Because I think between June and September of next year, that is when drafts of the final report to the legislature will be edited, refined by the board. And so what we will be disseminating, I don't think will even be complete is my expectation, by June of 2026. So yes, the plan will be done by then. And I think that also this work group or this work plan is a living document. And so as we get closer, we can always add more detail or shift things as needed. But that is my current understanding, is that the plan will be done in June and the actual dissemination will probably happen closer to September when we report to the legislature.
Cool.
Because we'll need final materials for that.
Right. So, but so we won't exist as a committee likely past June. So we'll sort of be like handing off the plan to others to do.
That's where I am honestly a little unclear. Yes, this work group is scheduled to sunset. That said, I think that in that dissemination plan, all of the direction that you might want to give, who should be included, who should definitely not be missed, how it should be disseminated. Like all of that feedback is going to be part of this committee's work. So whoever is doing that final, actually implementing that dissemination plan will be doing it based on your direction. So no, I don't think this committee will probably be the ones doing the dissemination implementation, just like we're not the ones drafting the materials directly, we're reviewing them and giving input. And those final materials that will be disseminated based on the plan, you all will know the plan and you will have access to the materials because they're public materials on our website. And so if you want to go, continue to be involved and share those materials, you will absolutely be welcome and encouraged to do that. But yes, as a formal committee with staff support and regular public meetings, we will not be meeting in this way. Does that answer your question?
I'm getting more clear. Yeah, I appreciate that. Who will do the disseminating, or what can you tell me?
It's an excellent question. And here's what I know right now. And I welcome Amy and Mimi to add anything that I might miss. But so we have 2 contractors right now, one for communications, one for community engagement. We will need to make a decision in the next couple of months to either extend some of those contracts that are scheduled to end of this year or January of next year, to extend them so that they can finish out that communications work, or go through another contracting process, because it would likely be a contractor that would do that implementation work, guided by the board directly at that point, using the plan that you all create. That is my understanding. And I welcome Mimi and Amy to correct me or add anything I missed. So the exact person, I don't know, a consultant, gray outline with the question mark, guided by the board in implementing the plan you all create.
Yes, I don't have any additional information. I think we haven't quite gotten to all those details yet.
And the only other thing I would add is that because it has not yet been developed, the transition committee will also be heavily involved with this. So there is one, well, there will be one. We're just not there quite yet. So that's in the works. So just so you know, it won't just be like everyone leaves and just leaves a big notebook left or anything like that.
Yeah, like a dusty notebook with, I mean, I know that won't happen, but yeah, it's a funny image. Okay, thanks.
Thanks for those questions, Colin. Really appreciate it. And if you have more, send an email, let us know. And also that transition committee will be a similar process to how you all applied for this committee. So here's my little plug. If you can't get enough of this work and want to spend more time doing it, we love to hear it. Please apply for the transition committee. It'd be great to have some people for continuation, who are familiar with the work that has gone before, involved in that committee. And certainly that committee, be great to have some communications and community engagement perspectives there. So
Yes.
look. Any other questions, comments about the work plan? All right. Perfect. So we had scheduled, or, we had slated to have the work plan kind of approved. And so do we want to do a vote for that approval?
Would that be okay? Could we do a roll call? I think that just because it will go, if as long as people are, the question is are people willing to have this work plan once the typo is actually fixed on the document to go towards the board?
Great. I can kick that off.
Let's do it.
Okay, Amy Fellows,
Yes.
Michelle Glass,
Yes.
Grace Hawkeye is absent. Mickey Durding,
Yes.
thank you. Juan Pablo Villalobos Garcia is absent. Colin Stackhouse,
Yes.
Max Brown,
I think Max had to leave the meeting.
got it, thank you, absent. Jensina Hawkins, maybe had to step out. Looks like Jay Brown, absent. John Buzzard,
Yes.
thank you. Craig Newton. Looks like Craig had to drop off. Juana Jensina Hernandez Solis,
Yes.
thank you. And Jocelyn Ogden,
Yes.
thank you. That's everyone.
Great. Thanks, y'all. Thanks for your input. Perfect. So we've got 3 more agenda items and then a stretch break. Is that working for folks? Let me know, speak up and let me know if you'd like to take a break sooner. All right, so here is the quick style guide update. We are in the thick of it. We have so many awesome additions from you all. It's been really rich, and it is, so Amy and I were supposed to meet, to be totally transparent, on Monday to finalize those updates, but we were still working through the feedback and incorporating it into the document. And so that meeting got bumped. So we will report back to those of you who have given feedback with an updated draft to make sure that it reflects the feedback that you shared. Of course, knowing that we all, the style guide is a passion project for many folks here, and it relates to a lot of folks' lived experience and professional experience and things that people have a lot of thoughtful feedback on. And I don't think we can fit all the words in the document that anyone would actually use, which we definitely want people to use. So that being said, if we have missed anything important, please let us know. Once we've incorporated folks' additional final feedback and gotten kind of a draft okay, or an okay on that updated draft, we will bring it back to this work group, and it'll be ready to approve, do a final review and approval, and then go to the board. So that is where that project stands. And, the last time we brought it to this committee and reviewed it, there were a lot of like placeholders without any content. All of that is filled in, y'all. It looks amazing. There's so much great content in there. So I'm really excited. So I'm really grateful. And then where possible, we have been, where there are things that are, consensus items, we have been sharing those updates with Patty as she designs materials as well, so that work doesn't become official after we've designed all the materials and then it's not reflected in those materials. So that is the style guide update I have. Amy, did you want to add anything?
Nope, that's perfect. Yep.
Okay. Thanks for your patience. Thanks for your input. More to come. Any questions on the style guide? Okay. So this brings us to mission statement. So again, the mission statement, the board started with kind of a default mission statement. Not exactly sure where it even came from, to be totally honest. I think the board started with we had to start somewhere. So we started with some like draft materials, a draft work plan, a draft mission statement that was very basic. And now that we have been doing more robust communications work, like the messaging guide, And also all the committees have been working, and we all have a much better sense of like what this work actually looks like. And we have done like our values and principles work and really decided what needs to guide the work of the board. We felt it was time to update the mission statement, both for connecting to audiences, who live in Oregon, who are not involved in this work, and also for really clearly reflecting what we all are doing and why we're doing it. So the board had a strategic retreat in May where we discussed the mission and what we thought might need to change or improve. And then it came back to the board for more discussion. And there were 3 drafts that then were sent to Patty. And Patty basically took all the feedback from the board, wrote 2 options with a description of like why that some of the word choices were and framing were designed the way that they were. And now it's coming to you all for your input before both options go to the board for a final decision. So in terms of process, that is the background. So Patty's notes here are that some of the feedback from the board was that the board missions needed to be shorter, right? And so we have 2 versions that have both been shortened. They both reflect the same core values, which are universal access, equity, affordability, and sustainability. So making sure this is something that can, be financially sustainable for many years. But they are framed differently. So version A leads with the outcome. It's outcome first. Really the headline, right? People who live in Oregon get the care they deserve. And it really puts a lot of emphasis on the systems level transformation, and then it explains how the board is getting there. Version B also focuses on public outcomes, but begins with starting with the process, right? Basically, like we're creating a plan to do X, Y, and Z. So a little bit flipped. So if we could scroll down a little bit. So here's version A and version B. I'll just be quiet and give folks a couple minutes to read these, and then we can discuss. And then if anyone, I know sometimes Zoom isn't super friendly on the eyes, especially if folks are like listening on their phone or something like that. So I wonder if anyone would be willing to volunteer to read both of these out loud, just so that everyone on the call can know what we're discussing. Anyone feel like reading version A and version B? If not, I can do it.
I will if nobody else.
Go for it.
You've been talking a lot today. Okay, so version A says we're designing a plan to ensure every Oregonian gets the high quality, equitable health care they deserve through a simpler, more affordable, and more sustainable system. Our goal is to replace today's fragmented model with one grounded in fairness, access, and long-term stability for families, businesses, and the economy. And in version B, we're creating a strong, workable plan so everyone in Oregon can get the high quality, equitable health care they deserve. This new system will be simpler, more affordable, and more sustainable, cutting costs for families and businesses while building a healthier, more stable future for our state.
Thanks, Amy. Do folks have any questions about version A or version B or about the process? All right. Does anyone have any feedback or thoughts? And again, we don't have to choose one or the other today. The board will make that decision. But do you have any feedback, or do you feel like these yeah, what are your thoughts? What's your feedback on these two drafts that would eventually go to the board? Colin.
Yeah, I like both of them. Version A feels a little more sensitive, or it's a little like softer language, and version B is a little firmer language. I guess if I had to give those two like attributes to it, I like that in version B it says new. I like that this new system. I like that in version A it talks about replacing the fragmented system. So those are two words that I like in both versions. I have my preference, but I don't want to say it right now. Yeah.
Thanks, Colin. Anyone else? Thoughts? John, did you have something you wanted to say?
Oh, yeah, it's a quiet group today, so I've been kind of holding back a little bit. I think overall the simplicity of the language in version B kind of, and I'll be a little bit more I guess I won't withhold my bias. I think I have a strong bias toward version B because I think the language is simpler and more relatable for someone who just happens to come across this that might not be saturated in kind of all the language and concepts of healthcare systems. I mean, the very thing that, you know, Colin mentioned about fragmented models and fairness and equity and et cetera, that's all stuff that may be like music to our ears because we eat, sleep, and breathe this stuff. But I think if you're an ordinary just a person on the street, like I think Michelle, you were describing earlier, someone's not just deeply embedded in this kind of vocabulary about health plans. You're just wondering, how can I pay for that health insurance, or how do I pay my deductible? I think the reason version B hits so hard, a little bit harder for me, is because number one, it literally says the new simple system will be simpler, and it talks about affordability and cutting costs in those two different spots. And so I think that's what kind of hits it for me, is that it is more direct. It's not kind of circular, or it doesn't kind of work its way around to the point with a lot of extra words and vocabulary. It's kind of just very direct language and ends pretty simply. I guess the only thing, and again, that's not why we're here today, but the one thing that neither of them really kind of talk about, we talk about more sustainable, we talk about access, but I think some people, we do touch on quality, so you can't have everything. But anyway, bottom line, I would, if we were, holding up hands to vote with the straw poll, I would put my straw up for version B.
Thanks for that. And, I think even though as a committee, we're not voting on these, we can certainly bring this feedback. And I see people chiming in the chat, agreeing with you, John. So thanks for raising those points. And thanks Jocelyn and Yesenia for your input in the chat. I think that what we can do is add some of that to that context that'll go to the board, those notes from Patty at the top that say, here's what to consider when you make this decision. The committee really felt that version B was simpler and more relatable to people who are not in the healthcare space, and might resonate beyond the circle of our policy BFFs, right? So that's a consideration that the board can then have when they're making the decision. So that's helpful context. Any other input or thoughts that we should include when this goes to the board? Perfect. All right. Thanks, y'all. All right. Last piece before stretch break. We have already looked at the communications plan. This is going to go to the board now as a final document. And I think that we made a few minor revisions or cleaned up a few things since the last time it was here. So we are just bringing it back for a final approval. We've already discussed it in depth, so I don't think we were going to dive in again today, but do we have, let's see, so attachment 7.1, if you're following along at home. And then I wonder if we can bring it up on screen, and are we wanting to do a vote for this as well? So again, just a refresher as we're bringing that up on screen, this is the communications plan that was the first deliverable for Patty Wentz's contract. So Patty designed a communications plan. We brought it to this committee. We all discussed it, gave input, and it is now going to go to the board as a final document. And so we just want to get a sign-off recommendation from this committee before that happens. As you can see, we are tightening up our processes. And so I know today there's a lot of revisions, editing, and approvals that we haven't had in the past. And it's exciting to get to this point, and I'm really grateful for all of your work today. So this is, hopefully this looks familiar. There's context, right? The moment we're in, there's the goal of the plan. These pieces are, really reflective of the messaging guide. We've got 6 pages here. This is like objectives and deliverables, basically, for Patty Wentz. So this is the work that she's going to complete under her contract. So if we could scroll just to do a quick review. The audiences that we are tasked by the legislature with communicating with. The tools to be developed. So strategic messaging guide, 1-pager, frequently asked questions doc, which is currently in draft mode and will be coming to you all soon. PowerPoint presentation, public speaking and media support. And then this is that piece you were asking about, Colin. If we're not able to extend our current contractors' contracts, then we would ask Patty to help us write a request for proposals to for our next communications contractor to finish out that work at the end of next year, the dissemination plan. And then the timeline, right? So when these things will happen. So pretty basic documents. And do folks have any questions or comments before we take a vote to finalize this and recommend the board approve it? Colin.
Yeah, looking at the 4th page of the timeline, it looks like we're supposed to be finishing our PowerPoint presentation at this meeting. Is that happening, or like a possibility, or am I misinterpreting that?
So this communications plan, it's a great question. The deliverables are for Patty's contract. So Patty is working on it, has finalized a PowerPoint presentation draft. I don't know when that will come to this committee, but that's a good question. I think since this is for her deliverables, like basically for the board to know what we've contracted, what we're paying a contractor to do and when to expect those things. That's my understanding of where we're at. Like Patty is on schedule for that. We are a little bit behind schedule on the frequently asked questions document, because I know that is going to come to CECC, and I know that Patty's working on that now, and it probably won't come to this committee until September. So some of these timeline pieces will continue to be a living document and probably need to be updated now before it goes to the board.
A good catch.
It's a good catch as I'm looking at this. Messaging guide is good. Mission statement options, communications plan, 1-pager. That's all on schedule. But if we bump PowerPoint and FAQ to September, can we scroll a little bit more? And website copy. Yeah, the rest of this actually needs to be bumped to, probably to be safe, it needs to be bumped to September/October. Yeah, thanks, Colin.
You bet.
Anything else that folks see that either needs to be updated or you have questions about before we vote? And again, we'll vote with the proposed changes, if folks are comfortable with that. All right. Then I think we're ready for a roll call vote.
Great. Amy Fellows.
Yes.
Thank you, Michelle Glass.
Yes.
Thank you. Grace is absent. Mickey.
Yes.
Thank you. Juan Pablo is absent. Colin.
Yes.
Thank you. Max Brown. Absent or had to step away. Jensina Hawkins. Absent. Jay Brown absent. John Buzzard.
Yes.
Thank you. Craig Newton absent. Juana Jensina Hernandez Solis.
Yes.
Thank you. And last but not least, Jocelyn Ogden.
Yes.
Thank you.
Great, great. We will make that timeline revision. Thank you, Colin, for the catch. And we will send it on to the board. All right, y'all, we've done a lot in the last hour and change. Do we want to take a little stretch break between or before we finish out with committee member updates, meeting reflection, future topics, and public comment? Or do folks want to finish up and then just close early? Happy to do either. How are folks feeling? It's been an hour and 19 minutes. So show of hands for a stretch break. All right, let's do it. It is 2:19. We're a little ahead of schedule, so let's come back at 2:30 and finish out. Thanks, y'all. All right, hopefully folks got a chance to stretch. We're gonna come back and finish out our agenda now. Folks on the committee can put a note in the chat or raise your hand or turn on your camera briefly so we know that you are back. That would be awesome. Thanks, Colin. Thanks, Jocelyn. Thanks, John. Thanks, Max. All right, we're gonna jump back in. So our last agenda items are committee member updates, reflections and future topics, and then public comment. And then I also want to make sure that we just make a quick announcement about a date change for our November CECC meeting as well before we adjourn. So let's start with committee member updates. This is where you can all share anything that's happened in the last month since last time we met, or anything that's coming up that relates to our work together that you would like other committee members and the public to know about. Could be outreach or events or webinars you were able to attend or what have you. So open up the floor to anyone who thinks, Yesenia, anyone who would like to share, please raise your hand. Colin, I'm going to start giving you frequent flyer miles. I don't know what you can cash them in for, but
I'm in this economy, I'll take it.
yeah,
So
right.
That's great. Yeah, this is not a personal update, but just an update on the Healthcare for All Oregon side of things, the nonprofit that's focused on universal healthcare reform in Oregon. We have been ramping up our community conversations, which I've sort of alluded to, but it's like, depending on where we're invited to bring speakers, we'll go to universities or wherever, and we'll give either like a 15 minute to hour long presentation about us and the governance board and just sort of our perspective on the work and the path forward. So we've been doing a lot of those, and we have a growing list of speakers who are able to go out into the community to go places where we're invited. So I think we have 10 on the books for the coming months, which is great. Last month, I don't think we had 3. So, we're sort of ramping up with that. And if anyone from the community wants to invite a member of Healthcare for All Oregon to come and talk about universal healthcare reform, that email address is speakers@hcao.org, Healthcare for All Oregon. And yeah, that's it's been really good, honestly. From our end, it feels really nice to be able to get out to community to do that. So yeah, that's an update.
Thanks, Colin, for that work and for that update. And yeah, and for how folks can get in touch if they want to learn more. Anybody else? All right. Let's see. Perfect. So that brings us to reflections and future topics. So how did this meeting feel to folks? What can we improve? What should we keep doing? And what would you like to see at a future meeting? Just open the floor. Any committee member that wants to raise your hand. And how did the voting feel? Like, yeah, anything we can improve here, let us know.
I'll keep flying. Felt good to me. Appreciated the yeah. It feels like our first or second rodeo voting, so felt fine.
Thank you, Colin. I joke, but I do appreciate all of your input and all of your thoughtful participation. So not trying to discourage that by any means. Thank you for that. All right. Well, you all know that if you want to give additional feedback, you can send it via email. So always welcome that, and we will of course check in at the next meeting as well. So that brings us to public comment. Do we have anyone signed up today?
I just wanted to check, Lou, do you have public comment today?
Yes.
Okay.
All right, so we'll have a 2-minute timer. Do we have that available?
Yeah, just 1 second.
Thanks for being here, Lou. Just bear with us a second.
There's 500 of me behind me. So, shall I get started?
Just waiting for the green light from Isabel.
Oh my God.
Isabel's in charge of the timer, so.
Isabel, for $5, would you give me another minute?
I'm not the one needing to be bribing.
Lou, we're trying to create a system that does not involve any corruption, so bribes will not be accepted at this
darn it.
meeting.
Okay, I'm really impressed with your one pager and your detailed one. I think that is fantastic. You did a really good job. Congratulations, is really good. Some of the stats were kind of a little bit off, or not. Maybe we could include, I don't know, like 60% of the bankruptcies in Oregon are due to medical issues. Also, insurance, people cannot afford to use their insurance, right? Such as out of pockets, $10,000 deductibles. So you might think about adding that in there. The other thing on the mission statement, we're going through some changes in HCAO of how we go about things, and how do we get people to pay attention to why we're doing this? And maybe you could, on a mission statement, you could start out by saying, we believe that everyone, because that's what the legislator is doing, right? We believe that everybody deserves to have blah, blah, blah. And so we're developing this plan to right? That's just an idea. One thing I did want you to be, I met with Whitebird down here. I don't know if any of you have heard of them. They're qualified federally health clinic, and it's a community medical group. And they were amazed. They had not heard of you, anything about the governance board. I told them about ORS 751 and etc. But they were in shock. So anyway, I don't know who's going to get this one pager or whatever, but organizations like Whitebird need to get this. Okay. Thank you.
Thank you so much, Lou. Really appreciate all of your comments and the time that you spend with us. I know it's a big commitment, but thanks for sticking with us. We appreciate you. Thanks for your comments. All right. Any other public comment today?
We did not have any additional signups.
Okay. So then I do want to, this will be sent out via email, and we'll change the dates on the website. But I do just want to flag for folks so you can make note in your own calendars that in November, we are scheduled to meet the day before a federal holiday on November 26th. And so we are proactively moving that date, anticipating that we might have a hard time getting quorum. And so the proposal is to move that to November 19th, so the Wednesday previous. So again, the November CECC meeting would move from Wednesday the 26th to Wednesday the 19th due to the federal holiday on Thursday, November 27th. So I hope that's supportive to the board, and I hope you get some downtime during that week. And again, more formal announcements will be coming, but I just wanted to give folks a heads up. And with that, I will thank you all so much for the great work today. I've got lots of notes to share back with our consultant, and I hope that you have a great month. We will see you in September. We are adjourned.
Thanks, everyone. Have a good afternoon.